Hi everyone, this is Dr. Ernesto and today I'm recording here in La Havana, Cuba, and I wanted to share with you how to take care of yourself when you're traveling to impoverished countries. Now if you get into trouble, health problems, you get sick or anything like that, and a lot of these places you're going to be out of luck. Let me show you a tour here of the pharmacy here. This is a pharmacy, a Cuban pharmacy here, and as you can see there's not a lot of inventory, so if you get stuck. La farmacia?
Hola, sí.
Okay. There's not a lot of stuff available, so if you get into a problem, you're not going to be able to buy what you need because everything's pretty empty. So what you want to try to do is, hi, buenos días. So you can't get a lot of stuff over here. So that's what a pharmacy's like here. Yesterday, I was talking to a Cuban person that immigrated to Uruguay, and he was telling me that he came over here to try to get a prostate surgery for his dad. He had to bring thousands of dollars. He had to figure out how to get everything, all the supplies, because he said they have nothing. And he said he was all ready for the surgery. He had the surgeon, he had the nurses, he had everybody ready. He had all the money together, and then they can't find an anesthesiologist. He says they're all immigrating out of the country, leaving for the United States. So that puts him in a tough situation. He's been here for a month. He says he hasn't been able to get the surgery, and he extended his trip another month to try to find an anesthesiologist. But if he doesn't find one, he's not going to be able to have the surgery. So you don't want to be in that type of situation. I've actually seen it in Los Angeles working in hospitals. I've seen patients that have been airlifted from other countries, and it's pretty gnarly. It's very expensive. The flight on a medevac is about $50,000 or more. Okay, I've seen families that have been financially devastated just for going away for like 5-6 days to a simple place, kind of like this place. So the way I protect myself is I buy travel health insurance. Okay, a lot of people say, well, I'm healthy. Yeah, I'm really healthy. I don't have any health problems. But guess what? Anything can happen. I broke my leg, and it costed me about $200,000. It was a lot of money. I had health insurance, but the bills were very expensive, and I still ended up paying about $20,000 or $30,000 out of pocket. So if you're in a developing country, forget it. You're not going to find stuff. You're going to end up dying, or you're going to get a limb amputated. That's what you want to avoid. So with my parents, since they're valuable to me, I buy health insurance. Travel health insurance is very inexpensive. It's way cheaper than health insurance you buy in the States. If you're in your 20s, their insurance costs about 50 cents a day. If you're in your 30s, it's probably about $1. I'm 48 and I'm paying $3 a day. That's it. That's nothing. And it includes a medevac. So all my medical bills will be covered, and they'll airlift me out of wherever I am in the world, Japan, Africa, South America, Cuba, back to the United States where I want to be if I get sick or if something serious happens to me. Now my parents, my dad's 73, my mom's 70, theirs is a little more expensive. It's only $11 a day. That's nothing. Very inexpensive. Now something happened on one of my trips where my parents got sick. I went to the hospital. In these countries, they don't let you pay later. You got to pay cash up front or you die. That's it. So you don't want to be under those types of circumstances, okay? When you have insurance, they'll actually speak to the hospital administrator and they'll tell them that your payments are guaranteed. They're going to get paid. So they're going to service you. They're going to pull out whatever supplies they have to treat you. That's what you want. You don't want to get stuck. I was talking to the people here at the hospital. They tell me that because they have such a shortage of medications and medical staff, they do triage on a daily basis. They pretty much let all the elderly people die. Or if someone has like a simple infection, they'll just amputate it because they don't have antibiotics. So you don't want to be in that situation. So spend the $3 or 50 cents a day for travel insurance if you travel to these places, okay? Thank you for listening. And from La Havana, Cuba, this is Dr. Ernesto. Thank you. Goodbye.